So my name's Declan Hadley. I'm the Digital Health Lead for Healthier Lancashire, which is a transformation programme very similar to yours, which isn't surprising because Sam Nichol works in Lancashire with me now on that programme. I also work one day a week with the NHSE. The presentation I'm going to give is really going to build on some of the themes that Paul picked out. I'm going to talk about technology, but not in a great deal of detail. And I'm going to go through some things, and I have a real view about the world. Maybe not exactly the conventional view of things, but I'm a real believer in the consumer. I'm a real believer in third sector and what third sector can do. Before I go on to that, I'll just give you a bit of context. So my wife and I, every December, have a discussion about Christmas. She is absolutely pants at picking Christmas presents for me. She says, I don't know what to get you. I have no idea. It's always some piece of technology, and if I get it, I get the wrong stuff. So last year, we decided we would sit down and I would write a list for her. So I wrote down 5 things. What I really, really wanted was a lens for my camera, but I didn't get it. What I got was Pandora's box. Sorry for the people in the audience who have seen this. Anybody know what this is who wasn't at the thing the other week? No? This is 23andMe. This is my personalised genetic test. So you open it up, you do a swab, you post it off, and then you get this sort of website link where you can go and see over 100 different characteristics of your genome. It's my personal genome. I can take that genome, I can download the raw data, and believe it or not, and you can test this out when you go home, if you Google that, your genome test, you can load that raw data up into a whole host of applications out there on the internet. There's also, if you go on the 23andMe website, there's a section in there called third party, and I was like, ooh, what's that do? So I went on and had a look. You can be very altruistic and upload your raw genome to some research on cancer, or there's this other one called Me and My Cousins. I was thinking, not so sure what that's all about. As far as I could tell, it was some sort of website that would allow you to make sure you don't sleep with your cousin. What I would normally show you now is a picture of Hayley. Hayley is a young girl who was on the news a few months ago. Hayley was born with an abnormality. No, that's not my slides.
Check it, small finger.
All right. She was born with a congenital abnormality on with her fingers. She had decided that, her surgeons had decided that they were going to graft her toes onto her fingers. Hayley's family weren't happy with that outcome. And what Hayley really wanted to do was, her family wanted to do was to look for other alternatives. Her father went on the internet and he explored a number of different forums and patient groups. Let me pick up a picture of her now. Oh, on one. See, technology always lets you down, doesn't it? Oh. Anyway, when somebody comes and shows the next slide, please. Okay, so this is Hayley here. This is his hand that shoved. So her father went online. He found out that there was a site in Brazil, the Open Hand Project. He discussed his condition with these people in Brazil. This person in Brazil sent him an electronic file, and he got that hand printed out for £50 from the 3D printer. And it changed this young girl's life. And that was a few months ago, and I thought that was a really inspirational story. What I found really interesting, as I looked at it a few weeks ago, actually, there are loads of people out there who are using technology and taking control of their conditions and taking charge of what they need to happen. So, if I move on. I myself, as you know, are an avid user of technology. I'm going to get on track in a minute. Now we'll get back to slides. We need the visual things. I'm a big user of Dr. Google. Unfortunately, for the GPs in the room, I went to see my GP a few weeks ago and said, I've got a diastasis recti. I hope I've got that right. And she looked at me as if to say, you could see it on her face, and she went, how do you know that? Who's told you that? Well, Dr. Google, I typed in lump in my tummy, and then found this YouTube video that could have been me. if I lie down and did exactly what it said, so I know I've got it. And she went, okay. So we had a bit of a conversation. She said, I'll refer you to a surgeon. I said, do I need to go and see a surgeon? And she went, well, I think you should, because you say, you've saved out complications. Anyway, I didn't really want to go, but I went. And I saw this surgeon. The surgeon said to me, why have you come to see me? I said, you've just got the thing I described. And I went, I know. So I was back with the GP, and we had this discussion with GP, and I was dying to say to this GP, I told you it wasn't a hernia. I told you, because the British Hernia Society categorised it not. What this means is, and we've already seen this, and you will have seen this if you're in practice, patients are already becoming empowered. Technology is here to empower them more. These 4 devices that you see around here, the one at the top here, anybody got one of these? This is a Microsoft Fitband. This is what I would call a next generation device. It's got a galvanic skin monitor on it. It's got all sorts of embedded sensors in it. This is one I got from China for about 20 quid. This one does all sorts of things. What this means, I think, is increasingly patients who used to come from being on the internet and say things to you are now coming with a whole host of telemetry about their conditions. This device in the top corner here, anybody idea what that is? Anybody aware of the tricorder challenge? No? Yep. This is, any of you who are Star Trek fans will know that the tricorder is this wondrous device that you just pointed at somebody and it tells you everything that's wrong with them. Well, actually, that's starting to become a reality. This is a company called Scandu. The prize is later this year. And this piece of technology, I don't think it does everything that the Star Trek one does, but it's a device that people might be using in their home. If you see, there's a really glitzy video of somebody diagnosing a child and then taking their child to A&E. So the technology's there. This baby at the bottom, I noticed William's in the corner. We were discussing this last week. This one here, anybody know what this is? IBM Watson. Anybody know anything about IBM Watson, what it can do? Yep. It's a bloody clever computer. It's so clever that if you rang it up, and you can ring it up and talk to it, you'd think you were talking to a human being. It won a competition in America called Jeopardy. So what's the relevance of that, you say? Well, I recently had the opportunity to listen to a professor from Berkeley who is doing some work with IBM Watson and IBM to create an application for rural Indian communities where they can ring up this computer, speak to it in their native language, and it will try and interpret what they're saying and give a very apparently a diagnosis. Evidence suggests that it's as good as you'd get speaking to a human being, because IBM Watson is connected to every medical database that ever existed or is likely to exist. It's that good. So the technology is starting to emerge that's going to actually really empower the people that we see, the citizens. And this one here, this is just a pulse oximeter that you can get from Tesco's or Maplin's, 20 quid. It was on offer last week. I was thinking of getting one, so I have a bad chest. Next slide. Oh, God, which one do I press? You'd think I'd know, wouldn't you? I'm a bit dubious because every time I've pressed it, something's gone wrong. Where do I point it at? We're not doing so well, are we?
Click the right button. It takes something when a GP tells them.
I know. We're just doing it for effect. Okay. So, how do I think technology is going to influence us in the future? This is my interpretation of this, but your triangle in the middle, you'll all probably have seen a variation of this. This one is biased towards Lancashire, particularly Blackpool, because it's got a combination of Kaiser and Oliver Wyman. So you've got, at the top, the people in most need. In Lancashire, and probably no different to here, 3% of the population are using around 43% of the resource or the spend associated with those 3%. Not saying that's wrong, that's just a reality that we have. Then you've got moderate need, well, that would be me and probably some people in the audience. And then you've got the bulk of the population who are healthy and well. I think all of our ambition is to keep as many people down here, or if you're in the middle, to keep them at the lower part of the triangle. So how is technology working? Well, we all talk about record sharing. One of the things I'm very keen to say is record sharing, yes, that's going to help public sector bodies, but actually it's got more purpose than that. So I think record sharing and sharing of information is going to help those people at the top of the triangle. Better coordinated care, right time, right place. Don't think anybody would disagree with that. The people in the middle, it gets a little bit more complicated. This is the empowered, patient-activated person. This is me with my information, my Google search, and in the future, my genomic data. I'm going to be quite empowered. I'm going to have probably more data about me than the people that I'm going to see to seek professional help from. And you might say, I need professional help. Empowering. This is where I'm saying that this type of record sharing, this is about giving people information, sharing what's being collected and gathered about them, and them contributing to it. And then we've got enable. This is the technology stack. Now, quite often we've been talking about technology in terms of stuff that you can get from Tunstall or video conferencing technology. I see it as a continuum. This thing that I bought on AliExpress at one end through to this kind of pods and modules with all the diagnostics at the other. Actually, I'm a believer that the consumer technology that's emerging is going to be more dominant in the future than the technology at this other end here. So for these two categories here, the bottom of the triangle, what we really need to be doing is empowering them with information and using technology, and in most cases, that's going to be their own technology. There we go. So, Paul, here's a view of what the future might look like in Lancashire. I'm getting the hang of this now. See? We have got two things that we're looking to do. A health records platform, what does that do? That releases information from the organisations which represent the public sector at the bottom. It's a real-time data exchange that moves information around the system into your clinical system. For me, that's really important. And my background's mental health. If you take mental health notes, we measure them by the foot. We're not talking about exchanging that whole record. We're only talking about contextual information relevant. So this diagram, the green is the public sector. This represents technology, this represents data, and that represents everybody else. I believe that we need to be able to move information around here for the top of the triangle. We also need to be thinking about the top. How can we harness the potential of that third sector? So if you accept that the sharing record solves the problem that we all face at the bottom, what we need to be thinking about is how can we then use that technology to share onwards. So the second part of what we're doing in Lancashire, and they're also doing this in Liverpool, is this concept of this personal wellbeing platform, this lifelong longitudinal record that sits with the citizen and has a consent model and application layer sitting above it. And that allows data to flow from here into there with the citizen's control then being shared as and when. It's not one application. I really must emphasise that. It's a multitude of applications. The other side of this is, at the moment, if you're using something like Tunstall, I don't have an issue with Tunstall, I think they're very good. But at the moment, and I've seen them fail in lots and lots of places, typically the telemetry of the equipment that's in patient's home is locked into a pathway, usually the community matron. Nobody else can actually access that data unless they need to. What happens if the patient turns up in a GP practice? Well, you can't see that. There are relevancies for why you might want to look at that data, and I haven't got time to go through them today. So what we're suggesting in the future, you bring the data into this platform at the top here, and then that mechanism, or the mechanism beneath it, allows that data to be federated, on demand, shared with whoever needs it, into the clinical system. This bit at the bottom is being built and is being tested and all sorts of stuff with support from NHS England and our colleagues from HSCIC who've been really helping with this. And this next bit, we're just about to start on that and do that with Liverpool. So all this stuff in here, this technological solution, is technology but with a purpose. The purpose is to empower people. That's what it's really all about. So why do we do that? Well, this is the model at the moment in most communities. We're connecting systems. These represent systems. In IT, you draw a little drum and that represents a system. And what we do is we connect them together, and usually in a point-to-point way, which is great. But when we start bringing the patient into the mix, it gets incredibly complicated. And from a patient's perspective, and the guy across the road went to me, his brother had a stroke, he said, yeah, we need to, the community support team haven't been out. Do I need to go back to the hospital and ask them? I said, no, it's not the hospital, it's another organisation that provides community. I don't think people really understand the complexity, the dynamics of the way we provide services. It's incredibly complicated. And technology can play a part in this. So some of the things we're doing in Lancashire, we're having less systems, so we're consolidating around primary care. We're connecting care and social care and health systems together, and we're creating a unified approach to the citizen. That's not one application. What we really want is we want simplicity, less systems on this side, and real diversity on the other side. Somebody challenged me at the event I was last week saying, shouldn't we just have one application? Well, no, we shouldn't. What about diversity? What about demographic differences? We want choice. We want a vibrant community of applications. We want people to use things. So if you're doing lifestyle and fitness, you want to link it to Tesco's, you want to link your Fitbit to it, you want to bring your BMI into that, that's your choice. So, you know, I really want to cultivate and make it really vibrant over here. The solution we talked about is all about allowing information to flow from those public sector silos into and onto these applications. And I think over time, the sort of really frightening thing is there'll be more data over here about us than there will be over there. And I think that's going to ultimately be a good thing. So finally, just wrapping up, I think the technology that we need to put in place is not just about the technology. We've said that already. It's about creating an ecosystem. 4 elements that I've described in here. The sharing of information, using that information to empower people, using technology to help people to remain independent, healthy and well, and using that data that's aggregated to drive knowledge. But there's also other aspects to the programme as well. The workforce, we can't underestimate that. I'm a great believer that Twitter itself and Facebook have huge application, very underutilised. Health literacy. Technology can drive health literacy. Talk about digital inclusion and digital literacy. It's health literacy that we need to be really thinking about. And technology can allow that to happen. It gives people information, ready access to information. And finally, the thing in here, economic growth. In Lancashire, and I don't know if it's the same here, but in Lancashire, health and public sector, well, health and social care is the biggest employer in the region by a considerable factor. We have a duty to leverage that investment to drive economic growth. And for me, on that other slide, it would be all those applications and things there, using technology to drive industry. Final slide from me. I talked about Christmas. This is my plan for this Christmas. I've talked to my wife about it. I'm dying for the dog to knock the other telly over. She won't, as stupid as she is. Just interestingly though, not only that is that my Christmas on my Christmas list, this is an incredible piece of technology, this one. There's lots like it. It's got a camera in it. Can do all sorts of things. A final thought for you in terms of going into these next sessions. Technology may not be something we prescribe and give out to people, to assistive technology. It could be something that's sat in the lounge. And there's an awful lot of research going on in universities about using this kind of technology. Thank you very much for listening.
Patient